What is dengue fever? Dengue fever is a mosquito-borne viral illness predominantly transmitted by Aedes aegypti mosquitoes. It has been a known disease for more than 200 years. The term, dengue, is derived from the Swahili phrase, ka dinga pipo, which describes a sudden, cramp-like seizure caused by an evil spirit. The Spanish likely adapted it to dengue, associating the severe joint pain experienced during the illness as a dandy movement. Dengue fever is caused by the dengue virus, which has 4 serotypes: DENV1, DENV2, DENV3, DENV4. The symptoms can range from mild to severe and can escalate into dengue hemorrhagic fever, DHF, or dengue shock syndrome, DSS, in serious cases. Common symptoms include high fever, severe headache, pain behind the eyes, joint and muscle pain, nausea, and rash. Diagnostic tests usually involve blood tests to check for the presence of the virus or its antibodies. Globally, an estimated 400 million dengue infections occur each year. According to the World Health Organization, roughly half of the world's population is at risk for dengue infection. Prevention mainly focuses on mosquito control methods, such as using insect repellents, wearing long sleeves and pants, and utilizing bed nets. A vaccine, denge vaccine, is available but has limited usage due to age and population restrictions. For more in-depth knowledge about dengue fever, including its complications and preventive measures, scholarly articles and research papers can be accessed through medical databases.